Hello, my name is Megan Carter. I am a DNAP student at Kaiser University, graduating class of December of 2026. My capstone project is titled Silent Guardians, Advancing Anesthesia's Impact on Postoperative Survival in Obstetric and Gynecological Care. This is a quality improvement focused integrative review. So, a little something personal. Before I begin discussing my project, I'd like to share why this topic is so deeply personal to me. Last year during semester 4, I experienced a misdiagnosed ectopic pregnancy, which unfortunately led to an ectopic rupture less than 48 hours later. This occurred a week before I was scheduled to take the C exam, which we all know is very stressful. What began as excitement quickly turned into fear, uncertainty, and ultimately loss. While I was fortunate to receive life-saving emergent care after my rupture, I couldn't stop thinking about how different my story could have ended if there had not been delays in recognition or treatment. That experience gave me a new appreciation for the incredible responsibility healthcare providers carry during obstetric emergencies. It also inspired my passion for improving maternal safety, not only as a nurse, but now as a future nurse anesthetist. Every mother deserves the care that's as safe as possible, and every healthcare team deserves the tools to provide it consistently. As I continued my education to become a nurse anesthetist, I realized that anesthesia providers are often the silent guardians during obstetric emergencies. While surgeons may perform the operation, anesthesia is responsible for protecting the mother's airway, circulation, oxygenation, and ultimately her survival. That personal experience drove this quality improvement project because every mother deserves the safest care possible. Little background on my project. So maternal morbidity and mortality remain significant public health care concerns in the United States, regardless of us being a first world country. Although modern obstetric care has advanced tremendously, preventable maternal complications continue to occur, and anesthesia-related events remain an important contributor to poor outcomes. Delays in care, ineffective communication, workflow variability, and inconsistent emergency responses all place mothers at an increased risk, particularly during obstetric emergencies. Healthcare disparities also disproportionately affect minority and underserved populations, further emphasizing the need for standardized evidence-based care. When reviewing the knowledge, I discovered that many poor outcomes were not caused by lack of knowledge, instead often resulted from system failures. Providers knew what needed to be done, but delays occurred because communication broke down, teams weren't activated quickly enough, or there was no standardized process guiding emergency management. That realization became the foundation of the project. The purpose of this project is to develop an evidence-based quality improvement protocol called the MomStat Anesthesia Protocol. The protocol was designed with 5 goals in mind. First, reduce anesthesia-related maternal morbidity and mortality. Next, we're going to improve interdisciplinary communication, standardize anesthesia workflows during obstetric emergencies, improve early recognition of high-risk patients, and lastly, strengthen CRNA leadership and maternal safety and quality improvement. Rather than creating new clinical recommendations, this project focuses on organizing existing evidence into a standardized workflow that can be consistently followed during emergencies. Methodology. This quality improvement focused integrative literature review was researched using PubMed, NIH, and Google Scholar. I reviewed 13 peer-reviewed studies along with national maternal safety guidelines. To evaluate the evidence of a systems perspective, I used 2 established quality improvement frameworks. The DNAP model, which evaluates healthcare quality by examining structure, process, and outcomes, as well as the SCIPS framework, which focuses on human factors, engineering, and how interactions between people, technology, tasks, and work environment influence patient safety. Using these frameworks allowed me to identify system-level opportunities for improvement rather than focusing solely on individual provider performance. Because no patients or human subjects were involved, this project was determined to be IRB exempt. After reviewing the literature, several themes consistently emerged within my results. First major issue was delayed anesthesia activation. Many studies showed that anesthesia consultation often occurred later than ideal during rapidly evolving obstetric emergencies. Another recurring issue was failed airway management. Pregnant patients have unique physiologic changes that make airway management significantly more difficult. The literature identified failed airway management as one of the leading anesthesia-related causes of maternal hypoxia, aspiration, cardiovascular collapse, which all leads to cardiac arrest. Another recurring issue were communication failures along with workflow variability. Different providers often approach emergencies differently, creating inconsistency in patient care. When obstetricians, anesthesia providers, nursing staff, and blood bank personnel were not communicated with effectively, treatment delays increased and patient outcomes worsened. These findings reinforced the need for a standardized protocol. So the MomStat protocol, what is it? The primary outcome of this project was to develop the MomStat protocol, which provides a stepwise approach for anesthesia providers during obstetric emergencies. With a few goals in mind. First, our first step was rapid identification of patients presenting with a positive pregnancy, pain, hypertension, or free fluid. From those results, we will activate the multidisciplinary team, which includes obstetrics, anesthesia, operating room, and of course the blood bank. The patient will need a rapid assessment, which includes airway evaluation, hemodynamic assessment, IV access to at least 2 large bore IVs, lab studies, and blood typing. Rapid sequence intubation equipment is very, very important. All mothers will be treated in a full stomach, with blood products available, and postoperative nausea prophylaxis. Induction strategy is based on patient stability, recommending ketamine or etomidate for unstable patients while maintaining rapid sequence induction principles. Also be an emphasis on early vasopressor use, balanced blood product resuscitation, post-intraoperative communication, postoperative monitoring, and measurable quality indicators such as time to operating room, checklist utilization, and protocol adherence. The goal is to reduce variation in care while ensuring that critical interventions occur quickly and consistently. As future CRNAs, we occupy a unique leadership role during all emergencies, but highlight in obstetric emergencies. We're often the first clinicians managing the airway, stabilizing maternal hemodynamics, coordinating massive transfusion protocols, and facilitating communication between multiple disciplines. Quality improvement initiatives like MomStat empower CRNAs to lead system-wide improvements. This project demonstrates that anesthesia providers can directly influence maternal safety through protocol development, interdisciplinary collaboration, and evidence-based practice. In conclusion, this project demonstrates the standardized anesthesia protocols that have the potential to improve emergency preparedness, reduce preventable maternal complications, and enhance interdisciplinary communication. Early recognition of high-risk patients combined with standardized workflows may improve perioperative care and ultimately maternal outcomes. While this protocol is evidence-based, pilot implementation is still needed to evaluate its real-world effectiveness, provider adherence, workflow integration, and long-term sustainability. So in the future, the next step for this project would be to implement the MomStat protocol in an obstetric practice setting. Future research should evaluate maternal outcomes, patient safety metrics, workflow efficiency, provider compliance, and long-term sustainability. Expanding implementation into rural and underserved healthcare settings would also help determine whether standardized anesthesia protocols can reduce disparities in maternal care across various populations. In closing, I'd like to return to the story I shared at the beginning. When I experienced my ectopic pregnancy, I never imagined it would become one of the defining moments of my time as an SRNA. Looking back, I realized that my survival depended on a healthcare team that recognized the emergency, communicated effectively, and acted without hesitation. Not every woman is as fortunate. That's why this project matters to me. And every maternal mortality statistic is a mother, a partner, a child, and a families whose lives are changed forever. As future CRNAs, we have the opportunity to be more than anesthesia providers. We can become leaders in maternal safety, advocates for quality improvement, and silent guardians for women during one of the most vulnerable moments of their lives. Thank you for your time.